Hi, everyone. Hope everyone's doing well. Happy Friday. Thanks for joining us today. I know the weather is beautiful out, so I really appreciate you all being here. We wanted to give just a small presentation on contact tracing as well as some of the testing protocols that have been going on in campus. I realize a lot of people have some questions, so hopefully this presentation will answer many of them. I do want to emphasize too, if I don't cover something or if you're not comfortable asking a live chat question, or at the end of the session, asking a question live, please feel free to email me or reach out. I'd be more than happy to talk to you. So I'm going to share my screen. I have a pretty lengthy PowerPoint presentation, so this should be helpful. This is being recorded, so this will also be sent out for anyone that couldn't join us today. But if you want a copy of the PowerPoint, by all means, just shoot me an email and I'll send it out to you as well. So let me share my screen. Wonderful. Okay. So this is pool testing and contact tracing at SUNY Erie. Like I mentioned, this is new to all of us, as you know. So we wanted to do kind of a comprehensive of what contact tracing is, what's pool testing, what does this entail? And we are, so I ask for your patience, learning as we go too. We were just recently given the mandate from SUNY, but I'll go into that more detail in the presentation. So the SUNY mandate came down in late August, letting us know that it is mandatory that students require testing. Students fit the criteria for testing if they're taking face-to-face classes only. So this has come up a lot where I've received a lot of questions about students who are, maybe coming onto campus for something once in a while. They are not included in this. So, and if you do hear back from a student, or if you are a student that's been contacted and you're not taking a face-to-face class, just simply talk to the scheduler and they will have you removed from the list. We've tried to painstakingly go through and make that list as accurate as possible, but as you know, some things do fall through the cracks. The point of testing, and we'll get into that in a little more detail, is to keep our campus safe. So just keep that in mind. Everybody's working towards the same goal here. Testing is going to be available on all 3 campuses and can be scheduled out as bi-weekly ahead of time. So that works really well for when you're scheduling, especially with a lot of our students who have jobs or other obligations outside of class time. So we're doing our best to try to make this as accommodating as possible and on their schedule ahead of time so that they're aware and able to participate as frequently as needed. The schedules are reaching out to students now, so they have a pretty lofty goal of trying to reach out and schedule 500 tests per week. So that's a lot. When we looked at our population counts for each campus, North, we primarily have the most amount of face-to-face classes, South then coming in, and finally City. So we will have 2 testing days exclusively on North, and then South and City will be available 1 day per week. I don't want to give the days of the week because we are alternating those days based on the needs so that we can best fit and accommodate schedules. So for more information on testing, or if you haven't received your call yet and you're really eager and want to get your test scheduled as soon as possible, please give our schedulers a call at the exclusive hotline for our pool testing at 270-4679. Employees are also welcome to participate in testing. This is not mandatory. It's totally voluntary, but we're more than happy to schedule you for a test. You can also call the same number to get that done. We're not reaching out to faculty and staff exclusively, but we did send out email information on that through the marketing email that goes out weekly. So how does testing work? So this is pool testing, and it's a little different than the testing that you have seen on the news or if you've already had a COVID test. So for example, what I mean by that is that samples are taken through a saliva swab, and you're included in a pool of 12. So you're with 12 other people. That whole pool is then sent to SUNY Upstate Medical for testing. If a positive is indicated in that pool, then additional testing is done on that. So the nice part about that is that we don't need you to come back in and get retested, which is so important. I know that question came up to a lot of people. SUNY then Upstate, the initial testing will take about 24 to 48 hours. And then if a positive indication comes from that pool sample, it will take an additional 24 to 48 hours. So the one thing I want to emphasize here, you're really only going to get notified if you are a positive test. So you're not going to get test results every week letting you know you're negative. But the nice part is once you come in, swab your saliva in your mouth. I know that sounds gross, but that's exactly what you're doing. It goes out to the lab and gets done in a relatively short period of time. So to keep that in mind, those that will be tested will not be exhibiting signs of COVID. I want to emphasize that because that's come up quite a bit too. Everybody who is coming onto campus to participate in pool testing has been screened 3 times on symptoms. They're screened initially when they schedule with the phone scheduler. They're also screened when they fill out the application through SUNY, which needs to be done ahead of screening. And they're also screened to come on campus as you normally would. So these are all asymptomatic testing protocols. So I just want to keep that in mind. The other thing I want to emphasize is that when you are testing, you will need a personal electronic device to bring with you to the pool site. And why that is because that associates you with your sample. You'll have to take a picture or scan your barcode and upload it to your registration, which you do ahead of scheduling. Ahead of your pool test, but the schedulers will go over that with you. So why are we testing? Well, as you know in the news, SUNY Oneonta had several positive cases on their campus and unfortunately had to convert to remote only learning. We don't want that. We're doing everything we can to prevent that happening. We'd like to continue the semester as it is scheduled. And we want to see the students, especially those that are taking face-to-face classes, be able to complete those courses. So it's super important that we all participate and try to help along with this. So you received a COVID-19 positive test. Now what? Your test results are going to be shared with the SUNY Erie contact tracers, and we'll go into the contact tracers in a minute, as well as with the Erie County Department of Health and reported in our daily health survey to SUNY. So the one thing I want to emphasize with the daily health survey to SUNY is that no names are associated with that. That's just a raw cumulative count of the amount of pool tests that we've conducted and any positives that come back from that. That SUNY Erie dashboard link can be found on our website and is updated daily. So right now there's not a lot of information there because we haven't started our testing yet. So in the next week, when we start this Monday, you will see that populated with a lot more information. One thing I want to note is that quarantine information that is on that dashboard will always be 0. We are a non-residential campus. We will never be quarantining anyone on campus. So I just wanted to emphasize that to everyone too, because I think that's misleading when you see that on there, because that doesn't mean that people in our community won't be quarantining, but they'll be quarantining on their own. You'll receive an isolation order from the Erie County Department of Health. Again, this is because you're positive. And you'll need to follow that order, including staying off of campus for the duration of your required isolation. During isolation, you should monitor your symptoms and may need to obtain another COVID-19 test. The Erie County Department of Health will assist you with that, and they will also work with you on contacting your healthcare provider or answer any additional questions you have and give you guidance on your health. You'll receive follow-up and a contact tracing interview also from one of our contact tracers, since probably if you are taking a test, you were somebody that was here on campus. So what is the difference between isolation and quarantine? I think this is important to know. Isolation is generally geared towards those who are currently ill and contagious, meaning they are positive with COVID-19 and they need to stay away from other people. So if you receive an isolation order, that means you're trying to isolate also in your house. So that means maybe sleeping in a separate room or having a separate bathroom. So for example, when this all started, I had the conversation in my house that if someone in my house tested positive for COVID, we identified a space that we would use for that person, trying to mitigate the risk to everyone else in the household and trying to diminish the spread of the illness. So you're going to avoid sharing things. You're probably going to throw out your toothbrush, all those things that we do when we have the flu or strep throat. But also you're staying home, not leaving the house. Quarantine refers to a person who's been exposed. And so quarantine orders are probably much more common at this point because it has to do with that exposure. So currently right now, in Erie County, our R0 value. And the R0 value is what it means when we determine what the spread is. We're currently around 1. So that means that for every one person that is diagnosed with COVID-19 in Erie County, chances are they could pass it on to one more person. At one point, that was much, much higher. So it goes to show you that all of these efforts that we're doing, wearing a mask, washing our hands, keeping our distance, are really helping. So quarantine will refer to those that have been exposed, had a good exposure. And I say good exposure, not in the positive sense, but good exposure that meets the criteria for quarantine. And that means they need to stay home. They don't want to infect others. They don't want to spread should they develop symptoms or end up being positive with COVID-19. We'll go into that a little bit more when we talk about contact tracing. So what is contact tracing? It's a symptomatic approach to identify contacts likely exposed to COVID-19, access contacts for symptoms and refer to testing when indicated, provide guidance on case quarantine and self-monitoring, and provide information, reassurance, contact, and follow-up. So it's a good way to determine where are clusters, what is happening. So if you remember the last few weeks, there was several rapid testing sites that were set up in Erie County. Those were very strategic on where they were set up in Erie County because those were identified as cluster areas where we had more positives in the county. This was a good way for those that would have had an exposure to be able to come in and get testing as soon as possible. So SUNY, again, we'll go back to the pool testing mandate, because we had seen this rise in college campuses, really at the residential campuses, but nonetheless, our highest infection rate we're currently right now, and the CDC just came out and said that, is that 18 to 24 age bracket. So this is the area that the epidemiologists and the public health officials are so concerned about. So this is why the testing is important, and then it spider webs into the contact tracing to let those know who've had that exposure that they should stop, quarantine, monitor their symptoms, and additionally get a test. So when is contact tracing most feasible and effective? And I put this on here not to bore everybody. I sat through a lot of epidemiology classes in my time, so I'm kind of nerdy with this stuff. But I don't want to bore anybody. I just want to give everyone an idea that contact tracing is most effective when it's early epidemic and lower numbers of cases. So now if you look at it from the standpoint of nationally or in New York State, our numbers have grown, right? We're a lot higher than we were from January, let's say. So with us narrowing this down to just our campus community, we're able to effectively do contact tracing. We're able to effectively identify clusters. We're able to identify certain concerns that we may have easier and more effectively. So in some ways, by narrowing this down, we're able to identify things earlier and get ahead of it. So I think that's super important. Today in the news, Buff State and UB both disclosed that their numbers have drastically decreased and they have already started testing. So that's a good sign. We're on that way and moving down that path of hopefully someday going back to normal. So what to expect from your positive case interview. So your contact tracer is going to call you. They want to establish a relationship with you. You're positive. They want to make sure first and foremost that you're doing okay. I want to emphasize this too, most of the people who are testing positive in that age range of 18 to 24 are asymptomatic. But I think it's important to have those conversations, know your body, know your health, monitor your temperature as well. They're providing that reassurance and education of saying, hey, this is the temperature. You should be aware of what's going on with you, your body, if you're feeling good. But also reminding them that you are contagious at this point and that you should stay away and isolate as much as possible. But the contact tracer's role will also be collecting information. So they're going to determine when that onset of symptoms was, if they have them, or the test date. And generally the rule of thumb from Johns Hopkins training is you go back 2 days before. So they're going to look at when did you start having symptoms. We're going to go back contact tracing and monitor where you were about 2 days before. If you just had a test and pop positive, what day did you have your test? We're going to monitor 2 days before that. They will then ask questions on contacts and get that information on the people that they may have been in contact with or may have exposed. They'll identify locations, visits, and activities, and they'll go over that isolation. Like I said, trying to really keep yourself in a pod, so to speak, within your house, which sometimes is not the easiest. They may also talk to them about other alternatives they may have in mind too. Any student or staff needs to, so if they're asking questions, if they're a staff member, who they should contact in human resources for information, or if they're a student, what they should do about their classes and who the contact information would be for that. They'll also explain the follow-up care to it. So they're going to verify this information with the Department of Health, but also how long of a duration do they need to be out? Should they think about getting another test? What happens if they do develop symptoms? So they're going to kind of explain the follow-up care to the situation as well. So what is actual contact tracing information that will be given to or to obtain from exposures? So your friend tests positive, you're in a class with them, you spent a lot of time, more than 60 minutes, you guys were talking, you were masked up though. You were following social distancing as much as possible, you've been washing your hands. However, your friend did pop positive. And I say pop positive because that's kind of the lingo, especially when it comes to pool testing. It's popped positive. So that person's popped positive and they were near you. So what happens now? You're getting a phone call from one of the contact tracers. They're going to establish relationship with you. They're going to talk to you. They're going to verify your contact information. They're going to figure out what's the best means to communicate with you. They're going to provide reassurance and education. And that includes, again, monitoring of symptoms, where you should go for testing, additional testing, if that's what you want to do, but also the quarantine process. So at this point, the rule of thumb is 14 days. So at that point in time, if you are taking a face-to-face class, or if you are teaching a face-to-face class, or you're working on campus, you're going to have to stay home. So they'll talk with you about that and talk about, how's your home set up? Are you able to quarantine? Again, we are a non-residential campus, so we don't have quarantines here on campus, but they will kind of assess that situation as well. They'll talk to you about any needs, again, discussing human resources if it's a staff member, and if it's a student, what they need to do for their classes, and then provide that guidance on self-monitoring and care. So what happens beyond contact tracing if a student or staff tests positive in a face-to-face class? So the contact tracers will do their interviews with not only the positive, but also they will present those findings to the COVID-19 incident command managers. Those findings include the amount of exposures in the class, the duration of the exposure, because that's super important as well, the location of the exposure, PPE use, and other factors. The determination on who needs to quarantine is determined by the Erie County Department of Health, which uses the 60-minute rule. So what that 60-minute rule means is that you, and again, this is keeping in mind that you have your mask on, that you're trying to maintain that 6-foot distance as much as possible, but you have been with someone who's been positive for more than at least 60 minutes. Let me emphasize that. However, and I do want to say the however part here, John Hopkins training, and this is kind of the next point that I have on the slide, is the training gives as 15 minutes exposure. So, but that's also with the notion that 6-foot distancing hasn't been in place and that there has been no PPE use. So we take all of those factors into play, and the college has made the decision to be a little more liberal with that 60-minute rule. Should we deem that that exposure was perhaps in a situation that 6-foot distancing wasn't in place, or the positive says, yeah, I took off my mask for a period of time, or whatever it may be. I would rather err on the side of caution and tell people, hey, quarantine, monitor your symptoms, or go get a COVID test, and work with that class on that as well. So these are case-to-case decisions that are made based on the contact tracer's investigative findings, talking to that positive, as well as when they get into the exposures too. So what if I test positive outside of the college's testing and I've been on campus? Well, then you should have an individual test done. If you've been on campus and you did come back from that individual test, and you were on campus 2 days prior to your symptoms or 2 days prior to your test, immediately give Mark Petrolic or myself a call. We'll work with you on that, and we will get you in with one of our contact tracers immediately to do an interview and talk with you on follow-up care. What if someone in my household tests positive? If someone in your household tests positive, you will most likely receive contact from the Department of Health that you've been exposed and that you need to follow your quarantine orders. Please be advised, and this is really important because I've gotten a lot of questions like my mother-in-law tested positive, but I haven't seen her in 2 weeks, but my wife was there, or whatever it may be. Be advised that contact tracing and quarantine orders don't take place for those that are 2 tiers away from the positive. It's that first ring that has been exposed to the positive. So even if it's someone you know, for example, if my husband went out and he was exposed to someone and got a quarantine order, it doesn't mean that I have a quarantine order at that point. Completely different story if my husband tests positive. So I just wanted to kind of emphasize that because that has come up a little bit. Quarantine orders, again, come directly from the Department of Health. They do not come from SUNY Erie. You may have a doctor that tells you, hey, yeah, just watch your symptoms, things to that extent. But the only people in Erie County that can sign off on quarantine orders are the Department of Health. So how is the contact tracing team using the Campus Clear app, call-in screening, or checkpoint screening information? So our contact tracers review any failed screenings from the app, the call-in, or the checkpoints every single day. So every single day. Any screening failures are contacted by a member of our contact tracing team. And the reason they do this is because I would say about 95% of our failures on the app are accidentally done. A few weeks ago, we moved that no symptoms button to the bottom. That seemed to help and diminish the amount of people that were inadvertently hitting the wrong button. This way they can clear that up and that's no problem. If you accidentally hit the wrong button on the screening app and you have that failure screen, you can call the call-in number, which is 270-4674, Monday through Friday, 7 a.m. to 4 p.m., and do the screening over the phone. They will then let dispatch know, and you will be cleared to be on campus since it was accidental. But let's just say that it wasn't accidental, you failed the screening. Those contact tracing team members will contact you for clarification, figure out what's going on with you, why you did fail the screening. They'll provide education and any information that's needed. So if you're not feeling well, you're unsure, it's not allergies, it's not something, it's out of the norm, you've developed symptoms, they'll discuss that with you. They're not going to give healthcare advice, but they may say you may want to contact your healthcare provider or you may want to get a COVID-19 test. So I want to emphasize that confidentiality is treated with the highest priority and regard. Testing results, quarantine individuals, failed screening, and any other related questions or concerns are limited to only those that need to know, with the sole priority of keeping you and the campus safe. No one is going to expose the fact that if you come back positive, your name is not going to be out there to your friends, your teachers, anything like that. You may disclose on your own, that's your own personal choice, but that information will certainly not come from one of the contact tracers. Even that, for that matter, if one contact tracer is working on a case, the other one doesn't know that information either. So that information is held very confidentially and secure as well. So if you have any questions or comments as this is going on, I please emphasize please don't reach out to me anytime something comes up. I know this is a confusing time, and even if I don't have the answer for something, I will work very hard to get you that answer, especially with the pool testing. We're learning as we're going. We're ironing out some kinks. We have a lot of students who are in healthcare who are currently now getting testing done on their own individually because they have to for an employer. We're working out a system so they'll be able to submit information to us and show us proof that they've had testing and won't have to participate in the campus-wide pool testing. But again, these are things that probably we're not, well, I can tell you, we're not in the mandate and we're learning as we're going. So please be patient with us, but by all means, if anything comes up whatsoever, please don't hesitate to give me a call or shoot me an email. So I say this I say this at every point in every meeting that I'm in, to always keep your distance, wear your mask, wash your hands, and of course, go Bills. So I'm open to any questions at this point. So I will stop sharing my screen and see if anything has come up. So we had a question about specifically, someone had missed the first few minutes of the presentation about pool testing and how does a positive result in the pool test affect the entire group? So that's a great question. So if in your group of 12, if someone pops positive in that group, we will be notified right away that that pool has been, has popped positive. We will contact everyone that's in that pool and let them know that in that pool sample, there was a positive. That does not mean that you're positive. What the suggestion will be, or excuse me, what we will tell you to do is quarantine for probably that 24 hours. This way, if you are the person that's positive, you're already in quarantine, you're already taking care of things, you're already trying to isolate away. But if you're not, it's really only 24 hours. We will happily provide documentation to anybody who needs it. So if you need an excuse for work or anything like that, or your class, we'll happily write a letter, not detailing anything, but just saying that you need to remain home. Again, that's why they're doing such a good job of trying to get these lab results out as soon as possible, so that when that sample is then divvied down to that individual sample, they'll be able to say, oh, that wasn't the rest of the 11 in the group, it was just this person. So the next question is about false positives. Then absolutely, I'm glad to answer this for you. So the nice part about this test is that it is a, again, this is a double layered test. So you have the pool that's sampled first, they're testing that, and then they're able to use a reagent. So based on the saliva that you still have, is that second part of the test is done. So it's kind of a double screen type of test. That's how they're working towards creating the efficacy of the test and making it so that it's as accurate as possible. Is everything 100% accurate? No. So I can't stand on that because I'm not the manufacturers of the test. But if you think you have a false positive, if you're not exhibiting symptoms, you can always go and get an individual test if you wanted to. You will still get the same order to still remain isolated and everything else. But chances are you're not going to determine that you have a false positive test based on this layer. So that's just something to keep in mind.
So Amy, this is not a question that's posted, it's Paula. But if staff decide, because again, you talked about the fact that this is a voluntary opportunity for staff, if they want to be tested, they can be. How often do you recommend staff get tested? Do they just come in and get tested once, or do they get on a regular schedule to do that?
I think the most effective way, if you're trying to determine if you're safe, if you're not exposing the rest of the community, if you're not exposing your household, and that you're interacting. So I've had a lot of people contact me, and I'll use staff as an example. The staff that have contacted me for testing information have been in a situation where they felt that they were more exposed. That doesn't necessarily mean it was a work situation. Maybe they went to a restaurant and it was overly packed, or they were at some kind of outdoor festival. They are recommending that everyone gets tested bi-weekly. That is probably the best way to monitor the situation that we're in right now, to make sure that you're doing okay. And staff are you're more than welcome to do that, but it's completely up to you.
And will this test actually show if somebody has an antibody, if they had perhaps been previously positive, but they're not actively positive right now?
This is not an antibody test. So this will definitely not show antibodies. Antibodies is a completely different test. And this is not going to show that. The thing with COVID, so one thing to keep in mind, and what we've been told by SUNY Upstate, is that essentially this is a 10-day duration. Does not mean that you might not still be sick or have residual problems from COVID, especially for symptomatic individuals. But the actual contagion period, the time that you're going to be testing positive, is a 10-day window from the time that you take the test thereafter. That's why they add those additional 4 days on. So from an antibody standpoint, this is not effective. This is not an antibody test. So I had 2 questions in the chat. If a person or a staff member shows up positive, when can a person return to school or work? The rule of thumb is going to be 14 days is the answer to that. After second test shows up negative. Oh, so if you test positive and then you decide to go get an individual test after that, and you talked to the Department of Health on that, and they agreed. If you come up with a negative test and you're able to produce results, you will be able to come on campus because your quarantine and isolation order will be lifted. Then the next question, if a faculty member answers positive to a symptom on the Campus Clear app, even a minor one like muscle ache, what will happen to their in-person class? Well, you won't be able to come on campus if you fail the screening app. If it's an accidental screening, we encourage you to call our screening call-in number or campus security, or come through the checkpoint and you can be screened then and there. So you're saying muscle ache. If it's not if you're someone who has a bad back that may have muscle aches here and there, that's not what the app is asking you for. It's for new symptoms. So what will happen to your in-person class? You'll have to refer to your department chair on that. Any other questions?
Looks like there's another question that came through. If I get a test and don't receive any news after the test, does that mean I'm negative?
That is correct. We are only receiving information on positives.
And again, Amy, can you reiterate when those test results would be given to people? So if somebody did take a test and they didn't hear any news, they would hear within how many hours, one way or the other?
One way or the other. So the first sample, your pool testing is done 24 to 48 hours after your test. If there's a positive from that, then you will be notified that there was a positive in your pool at that point, 24 to 48 hours after your test. Then they will do the reagent, which takes another 24 to 48 hours after that. Okay, next question. Will you be keeping track of those who test positive that are asymptomatic and then convert to symptomatic? That's a really good question. We do establish contact through the contact tracers and their Johns Hopkins training, which I want to emphasize too. I failed to mention that during the presentation. All of our contact tracers went through 6 hours of certification on contact tracing. So they're not shooting blind on this, which is good. They've had some minor experience, which is a good thing that they've had minor experience. So they will establish that relationship with somebody that's positive and check up on them. And they will be recording the information should something come up. So if that person's health status or their situation changes, they will make note of that as well. If a test comes up negative, will that person be able to return to campus? How long is this turnaround if the student is not notified? So I think that's the same question you asked, right, Paula?
Well, I asked the question. I'm just looking to see if that was the same question. Yeah, that was the same question we just asked.
Okay.
Looks like one more just popped up. There's a lot of students that are stressed because they have labs and clinicals that have to be completed or they can't graduate. Will the entire lab be shut down if one person tests positive?
Okay. So the answer is I can't answer that. And the reason why is because lots of things are determined and if a course section needs to be closed. And when I say closed, that's for a 14-day period. That's not for the duration of the semester. This is why we are pool testing, so that things don't get shut down. So it doesn't necessarily mean just because one person is positive in a class or in a lab section. I mean, there's lots of factors that take into place, the space, the way students' movement is in the class. But even if that is the case, and we do have to shut down a course for a period of time, it would only be for a 14-day duration. Any other questions? Okay. Well, thank you so much for joining me today. Like I said, it's so beautiful. If anything comes up, don't hesitate to shoot me an email, give me a phone call. I'm more than happy to answer anything. Um, I know this is a kind of a strange time, and I'll be honest with you. Never in my life did I ever think that we'd be organizing testing on a college campus. So it is different. But we're doing this because we want everybody healthy and safe, and we want to be able to continue this semester and look towards the spring. So if anything comes up, our schedulers are there to answer questions on when I can get scheduled. They're individually reaching out to those students, but we're willing to work with anybody and answer any questions that you do have. So again, keep your distance, wear your mask, wash your hands, and go Bills. Thank you, everyone.